And you're live.
And a good early afternoon to you all. This is Dr. Ara Duke-Machen. We're broadcasting spine surgery live from Duke Spine Institute. And we've already completed a 5-level Duke laser disc repair. And this patient is the opposite. She's a 1-level. So we've done the longest and now we'll do the shortest. She has a disc that's herniated at L4-5 to the right side, and it's causing horrible back pain and right leg symptoms. And our patient is here in the operating room laying on her belly. Are you comfortable? Yeah? All right. It's Dr. Duke-Machen. We're going to get started, okay? Are you comfy then? Your neck's okay? All right. I'm going to touch your back with my hand. That's just my hand, okay? I'm just going to kind of feel around for the right place. Just relax your muscles. You're so tense. Are you excited to get this done and get it out of the way? All right. This is the right side. We're all in agreement. You're going to feel me pinch you with my fingers, just a little pinchy pinch, and then you'll feel a little stick and burn, okay? That's just the numbing medicine going in. You feel that? Yeah, that'll burn just for a second and then it'll start feeling better. So our patient has, how long have you had back pain? How long does it go back?
It started in May.
So May of this year? And you never had back pain before that? You had what? A year and a half ago?
Yeah.
So is that when it all started? But before that you were perfectly normal, never had back pain? So a year and a half ago it started, and then it kind of got a lot worse 6 months ago? Okay. All right. All right. And how much leg pain do you have? Constant leg pain? The right side? All right. Well, hopefully we're going to get rid of that today. That's what I expect. Remember what I told you. If you have discomfort, just say ouch, and I'll give you some more numbing medicine, okay? Try not to move around, all right? I'm going to give you a little bit of numbing medicine just to make you more comfortable. So these surgeries always start with our patients awake when we're doing a lumbar, which is the lower back, or thoracic. And the reason for that is I need the patient's help to get to the herniated disc safely. So the most important thing for me with surgery is that it's done safely, and then the next most is effective. So we want safe, effective surgery. And safe, effective surgery means that you have to make sure you don't hurt the patient while you're doing surgery, and that you get the surgery done so that they achieve their goals. So what are the patient's goals for surgery? Well, they want to get rid of the back pain and the leg pain, for sure. That's why they're here. Okay? And my goal is to get rid of her back and leg pain. To do that, I know exactly what I need to do. I need to fix the L4-5 disc. And specifically, what am I fixing? Well, there's a herniation there, okay? And there's a tear in the back of the disc. Where do you feel that? All right. So she has a herniation and a tear. And just your back, right? Shot. And her herniation and tear are what are causing her back and leg symptoms. Just relax. You're doing fantastic, by the way. Everything's going really well, okay? By the way, do you have any questions for me? I'm navigating past her facet joint right now. She has some arthritis there. I can actually feel it. Let's get an AP. Now our target is, and you can actually see the herniated disc on the x-ray. That's how good this x-ray machine is. We have the very best x-ray machine in the world. And the name of the manufacturer is Siemens. Okay, Siemens. It's a German company, and they make the very best x-ray machines in the world. And you pay a price for it. They're the most expensive. So our x-ray machine that we're using is called a fluoroscope. It's actually portable, so it moves, which you want something portable, so you can move it around from one place to another, depending on where you're doing your surgery shot. And basically, we move this x-ray machine from room to room so that we can use it in other areas of the facility. It's not just stuck in one location. Okay, so unlike some x-ray machines that are fixed, they're called fixed, meaning that they can't be moved. These fluoro machines are portable. Shot. And because they're portable, we're able to move them around. Shot. And because we can move them around, we can use them in different areas of our surgery center to help patients that need different levels of care. Shot. This happens to be the operating room. Are you comfy? So what I'm doing, if you're looking on the right side, you can see the spinal needle. We're targeting L4-5. Luis, you agree? I agree. All right. And it's interesting. You know, we do a lot of talking about this. This is really a great case. I'm going to tell you why. The bone below the needle is L5, okay? And then you got the tailbone or sacrum below that. You can clearly see the L5-S1 disc space. Can you point to that? Yeah. Okay, so can you guys see the arrow, the white arrow there, Diego?
Yes.
Oh, beautiful. So Jordan is showing you the L5-S1 disc space. Show them the sacrum or tailbone. Beautiful. That's a tailbone. It looks like an ice cream cone on its side. Now go up to the L5-S1 disc space. That's the L5-S1 disc, okay? We don't believe it's causing her pain. Now go up one. That's the L5 bone right there. And then, now look at just below the arrow. Show them the iliac crest. This is really quite interesting. Yes. And kind of trace it side to side for them. Look at that iliac crest. That is a low, low, low iliac crest. If I had to do L5-S1, she would be the perfect candidate because the iliac crest normally goes through the L4-5 disc space, much higher. So it's really hard to get down to the L5-S1 disc space. But because her iliac crest is low, it runs through the bottom half of the L5 vertebral body. That means getting into the L5-S1 will be pretty easy for her. But we're not treating L5-S1, we're only treating L4-5. So now we're about to enter the disc herniation. You feel anything? All right, she's still comfortable. So the tip of the needle is literally touching the disc herniation. You can kind of see a little bulge out of the disc right there. Let's get an AP. So before I advance this, I want to make sure on the front to back view, the AP view, anterior posterior, that we're in the right place. It's looking pretty good. Yeah, I'm happy with that. You can see the bulging disc there, lateral. So we're in pretty good position. And shot. Yeah, we're in really good position. This is perfect. You feel anything? And what I'm looking for, I want to see if there's any pain down her leg. Any pain down your leg? Huh? Where? The front of your leg? How far down? How far down? But not past your knee. Okay. Not down to your ankle or foot, right? Where are you feeling? I can't hear you. I need the anesthesiologist to tell me what she's saying. Doctor, can you tell me what she's saying?
How far down? Yeah. Down front, mid-hip.
But not down to your calf or ankle. Try not to move around, okay? You're making it a lot worse when you're moving around. Yeah. This is your painful disc. This is why we're here. So it's not unexpected that you would have, just lay still. Put your head down, please. AP. It's not unexpected that you would feel something here, okay? So this is the L45 disc. We're entering the tear. The tear is where all the back pain comes from. And she's clearly responding because we're entering the tear basically in the disc. You okay? All right. I'm sorry it's so uncomfortable. But we are at your painful disc. We're entering the tear that we're about to repair. Just try to lay still. I know it's a bit uncomfortable. We're almost done. All right. You better? All right. Well, the good news is all that pain's going to be gone when you wake up. All right. Just give you a minute to relax, okay? All right. I'm done moving that around, okay? So what's going on here? Inside her spine, in between the bones or vertebrae, is a cushion, and it has a special name. It's called a spinal disc. And for thousands of years, nobody really cared about it because it's not a bone, it's not a ligament, it's a pad, it's a cushion, it's a joint. And people have ignored it for thousands of years, never really understanding how important the disc is. But in the center of the disc, you okay? In the center of the disc is the nucleus propulsus. The nucleus propulsus is, for those of you who want to know, is the remnant of the notochord. Notochord is an embryological structure that's found in an embryo, early embryo, that induces other cells in the embryo to become everything we are as adults. Whether they're muscles or organs or skin or bone, everything is directed by the notochord. When the notochord is done doing its job of directing tissues to differentiate, these are germ cells, these are stem cells basically, to differentiate into specific organs and bone and tissue, the notochord becomes the nucleus propulsus. And people forget about it. But actually that most important structure in an embryo becomes another most important structure in an adult. Are you comfy? All right. Sean, how bad is that on a scale of 1 to 10? Okay. Is that where you typically get your pain? Yes? I'm sorry, sweetheart. I really am. We're going to put you to sleep now. All right. So clearly this is a very painful disc for her. All right. We're done. We're done. We're going to put you to sleep, okay? When you wake up, that pain will be gone. Okay. That pain will be gone. Count for me from 1 to 100 out loud so we can hear you. All right. So if you look at the... can you point for them, Jordan? Just count out loud. We're going to put her to sleep, and we'll finish the surgery while she's asleep. All right, so the arrow is showing you where the dye is injected in the middle of the disc. Now trace the tear. And there's the tear, and the dye leaked out, and show them the nerve root right there. You see that curve? Yes. Jordan's right on it. That's the nerve root. That's the L5 nerve root. It's right behind the disc, and you can see how the tear has allowed liquid to drain around the nerve root. So imagine if that liquid was inflammatory liquid, like a bleach-like substance that the disc releases as it degenerates. That bleach-like substance is going to get on that nerve root and cause leg symptoms. Plus you can see a herniation there. Show them the herniation. So you saw the nerve root, right? Show them the nerve root, and then right in front of the nerve root is the outline. Yes, that's exactly it. Jordan has nailed it. That's the herniation. So you can see the herniation making contact with the nerve root. We're going to go ahead and get started because she is asleep. We've gotten the green light. Let's make sure that the guide wire stays in place. It is. We're going to bring the spinal needle out. Now we've injected not just Omnipaque to be able to see on the x-ray to be able to see the disc and the tear and the nerve root and the herniation. But we've also injected, that's fine. I'm not worried about it. It's probably just a little bleeder under the skin. We've also injected a blue dye called indigo carmine. And indigo carmine dye has a very special property. It's number one, it's royal blue, which is the color of Duke Spine Institute. And number two, it looks like alien blood. But no, the important thing is that it stains, it adheres to, binds to degenerated nucleus propulsus. And remember, I told you what the nucleus propulsus was. It was the notochord in the embryo. So go look up notochord, and hopefully for those of you who like embryology, you understand how important the notochord is. If the notochord doesn't do its job, we don't get created. So that all very important tissue or structure becomes this nucleus propulsus. Yeah, her leg is responding because it's so irritated. And that went in pretty easy, to be honest with you. Shot? Yeah. She has a huge tear. And it's allowed a big herniation to come out. And that tear and herniation are what are causing her back pain and her leg pain. And we're going to get rid of the back pain by debriding the tear. We're going to get rid of the leg pain. Look at that. It caused the dilator to pull back. Shot? There's so much pressure in her disc, it's literally pushing her dilator back. Shot? That's it? Shot? You're okay? Shot? And we don't want to biopsy her disc. We just want to advance, one more time, the tube. All right. So her nerve is extremely irritated and angry because it's been pinched for so long and so hard. She actually has constant pain in her leg now. So we're doing this entire surgery. Can you see this, Diego? With a 7mm incision on her back, a Band-Aid incision.
Yes.
We're doing the whole thing through a little tube. This is endoscopic surgery. This is endoscopic spine surgery, and this is true endoscopic surgery. There's a lot of surgeons that say they do endoscopic surgery, but they don't. A true endoscopic surgery is a single port, and you have an endoscope that does everything from irrigation to suction to light to magnification and a working channel, and that's what we have here. Okay? So we have a true endoscopic procedure, single port, endoscopic. Boy, this disc is seriously inflamed. This is an angry disc herniation. Hypervascular, a lot of inflammation. Okay? And it's all gooed up together, so pieces are not coming out. Ready for the laser? We're going to get started here. The laser fiber is blue. You can see it in the endoscope now. And the blue is just a plastic coating on the outside. If you look carefully, you can see a glass rod. The glass rod is what transmits the laser energy from a machine that's at the patient's, near the patient's feet. It's actually not on the patient's feet, it's near it in the operating room. Just grab it properly. You know how to do that? Okay. So the laser's here, and it's generating energy in the form of electromagnetic radiation. And that electromagnetic radiation is being delivered right here to the end of the laser fiber by a glass pipe, a glass tube. This disc is really badly damaged. That I can tell you. This is all inflamed and scarred up. So what does scar tissue do? What does inflammation do? Inflammation creates damage to tissues, and it creates scar tissue, ultimately. And if you have chronic inflammation, you get chronic scar tissue, a lot of scar tissue forming. Can anyone think of anything that involves chronic inflammation? We talked about one of these diseases last time, rheumatoid arthritis. What happens in rheumatoid arthritis? Well, you have inflammation that just keeps going on and on and on in the joints, in your hands, and what happens, you get all this scar tissue forming in those joints, okay? And so it's the scar tissue that has nerve fibers in it, painful nerve fibers, and that's why it hurts. If you're breaking up the scar tissue, it hurts. So when rheumatoid arthritis patients move their fingers, they hurt because of all the scar tissue with little nerve fibers in there that are getting torn with movement. Unfortunately, the only way to get rid of the inflammation sometimes is to use powerful anti-inflammatory medications. But the problem is, how are you going to deliver powerful anti-inflammatory medications to a disc in the middle of your spine? You can't. You can only do a steroid injection, but even then it doesn't get to where the medicine needs to be. So really the best treatment in the world is this, what you're watching right now, the Duke laser disc repair. And I created this treatment for the purpose of getting rid of the source of inflammation inside a herniated disc. That source of inflammation is the annular tear and the herniation. This is a big tear. Side to side, top to bottom. Can we put her a little deeper? Stand by. What is that, Luis? You see it?
On the bottom,
Right there.
the shadowing.
Yeah. I mean, this company, I think we're okay, but there's something going on. I don't know if it's on the actual lens or where. She all right?
Say she's in a bad place.
She is. I need about 5 more minutes. Gosh. It's a pretty new herniation too. You can tell there's just, even though there's a lot of soft nucleus, there's also some scar tissue, but a lot of this is soft. You can tell it's more recent. It's typical for herniation to have multiple phases of herniation where you get the older injuries cause or get scarred in. By the time you come in and treat them, they're more scarred up. And then the newer injuries are softer, less scarred up. So what I was trying to say earlier was, you know, take a person who has alcoholism, right? They're drinking alcohol all the time. They're killing their liver. They're creating inflammation in their liver. Well, the liver is getting inflamed. Same thing with viral hepatitis. Whether it's alcohol or virus, the liver is under inflammation constantly. And it scars. You get what's called cirrhosis of the liver, okay? Cirrhosis is a scarring of the liver. And it's scarred from injury, chronic inflammation. Whether it's alcohol causing it or it's a virus like hepatitis C causing it. And the end result is the same thing. You have a scarred up liver. Okay, now this disc here is scarred up. really bad. And what's causing the scarring is chronic inflammation. Same thing that causes the scarring in a liver. Not alcohol, not a virus, but a herniation. Everything okay? I need 5 minutes and I'll be done. Doctor? When is our telemedicine this week? Thursday? All right. Will you do me a favor and look at the scopes Friday then? And check each one and make sure that they're all good. Get someone to help you. Do we know when our guy's coming back? Got it. Do we know any of those results? Sure. Huh? Yeah, I hope he's all right. All right, just about done here. And I checked on our first patient. He's doing fantastic.
I didn't expect all that.
Huh?
You didn't expect all the upfront awake.
Oh, really?
Okay.
Yeah, he did. He's watched me do surgery. He can't, I mean, I broadcast the entire surgery, you know, every time it's the same thing. So, by the way, do we have any questions? Diego.
Not as of yet.
All right. Irrigation, are we okay? Yep. Just about done. There's the nerve root right there. You see it? That white thing? That is the nerve root. That is the left side L4 nerve root. That's what was getting crushed and irritated. Plus the L5, which is just at the 12 o'clock position. I don't think we'll see the L5. So I'm just below that nerve root right now, cleaning up this last bit of herniation. Yeah, she's not happy with me right now. But we're pretty much done. Okay. Looks good.
We have a question from Facebook.
Question from Facebook. Go ahead.
Where can we see an endoscopic view of a healthy, undamaged disc with no signs of herniation?
I kind of barely heard that. I heard endoscopic view, healthy, undamaged disc. Is that, can you repeat it? You're just a little too low for me.
Okay. Can you hear me better now?
Yeah.
Okay. Our commenter asked, where can they see an endoscopic view of a healthy, undamaged disc?
That's funny. Where can you see an endoscopic view of a healthy, undamaged disc?
Yep.
I don't know. I've never seen one. I mean, we don't do surgery on healthy discs. So maybe in Turkey, where they still torture people and do human rights violations. I'm just kidding. And if I offended anybody from Turkey, good. I hope so. Remember the genocide, the Armenian genocide. Okay? So I don't apologize for being offensive to Azerbaijans and Turkish people. Every other Muslim I like, no problem. I don't have a beef with you. But the people that slaughtered my people, I do have a problem with you. And never admitted it. Alright, so the answer is I have no idea what a normal disc looks like. I'm just kidding. I mean, I somewhat have an idea, but I've never seen one. We don't do endoscopic surgery on normal discs. So I don't know anybody who does. It would be unnecessary, and it would be dangerous, and it would be basically malpractice, in my opinion. Alright, we're done. So, again, the nerve root looks good. It's been decompressed in the foramen. I'm very happy with that. I think she's going to be very happy too. Sorry to be so cheeky with some of my answers, but yeah, that's just me. That would be like asking what does a normal spine look like when you open up and look at it. I mean, unless you're doing a cadaver, a dead person, and that's the only way we could find out, to use a cadaver body and go inside endoscopically. And I haven't done that. I need more irrigation. And then put it down. Just lay still. We're almost done. We're almost done. Dilator.
Another question from YouTube.
Sure.
How long from the MRI review until the day of surgery?
How long from MRI review to the day of surgery? We could do your surgery the next day if you want. It's just a matter of how long till the patient comes here. A lot of our patients, 60%, are now out of state. They come from other states and other countries. So it's a matter of flying in or driving in. And typically we'll see the patients on Monday. There's surgery Tuesday, and then they get a checkup and they can go home Wednesday. So the whole process takes 3 days. But if you were to show up on Monday and you're ready for surgery Tuesday, and I meet you and check your MRI and make sure that the pain you're having in your back or neck is actually coming from the herniations that need to be repaired with surgery, if that can make that connection, which I usually do very quickly in the office, if that's the case, then we could do your surgery the next day. So for people that are very motivated to get fixed quickly and they don't want to wait, you come in on Monday, we surgery Tuesday, and you go home Wednesday. It's the fastest surgical evaluation, treatment, and recovery of any spine surgery in the world. And there's no hospital stay, folks. This is outpatient. All of these surgeries you're watching are outpatient. These patients go home usually 1 to 2 hours after surgery. We looked at our average recovery, it was 53 minutes. So in 53 minutes, the patients are discharged. All right, from the wheels out. Take a look. Here's what the incision looks like. You see that? 7 millimeters. Still losing a little from the muscle. You need to apply pressure for another couple of minutes, Luis. Come on over here. You can stand where I am.
No suture?
I would put a suture.
Yeah. Okay.
But I give her a couple more minutes of pressure. All right, type up your questions. I'll be happy to answer them for you. And I'm going to head over to our broadcasting room, and that way I can look at you and you guys can look at me. I really can't look at you. I'll just imagine you. Again, I'm Dr. Ari Duke-Majan. You're watching a live stream of a Duke laser disc repair, endoscopic repair for a herniated disc causing back pain and leg pain. L45, the most common disc by far in the lumbar spine to be symptomatic.
All right, we're clearing for takeoff.
With back and leg symptoms. No complications, EBL 3 mil.
This is how
And
normally
this was
I'm
a
running about like
right
this. I've got my arms out.
L4, 5, DLDR.
Like I said, after about an hour, it was getting excruciating pain.
Thank you, everyone.
Just going across my back.
What is the next case? She's a 4 level.
He's fixed all that. As long as that's fixed, I'm ready to go. $30 ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that and did an end over the handlebars and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon as I hold my arms out for the matter of an hour, just the way the steering wheel is positioned on the RV, it just sends excruciating pain across my back, gets down to my hands where my hands are numb. Me and the wife, we have to pull over, rest stop. After 2 hours, it's incredible. I just got to get up, take a break, shake my hands. Well, if you're going on a long trip, 2 hours don't get you very far. Just like lifting up this, I was having a hard time getting into my engine compartment. Just every little thing that you take for granted seemed to become a bigger problem and bigger problem as far as my neck. I went to Dr. Duke's to try to get fixed, and he did an expert job. Looks pretty good. Fixed it all up for me. Went in through my neck, went around to hit the back of the spinal cord. I still don't know how they do it. Unbelievable. But no scars, didn't hurt at all. As you know, when I woke up, it was totally painless. My surgery was done on a Thursday. I went back to work Monday. Pretty awesome. Once I've gone to the Duke Spine Institute, it's amazing. Once you take that pain level down, it's like, whoa, there's nothing. I mean, it's night and day. I mean, I just can't even describe it, how good it is. You know, I feel like a new man again. Now that I'm back driving the bus again, it is fantastic. Now we can get behind the wheel, drive for a good 8-9 hours, and then take a rest where I want to and not where I have to. What a difference. Fellas, I'm telling you right now, if you've got the pain I've got, you call me.
Just below
We'll
the
talk.
arrow, show them
Anybody
the
can
iliac
call me
crest.
anytime.
This is really quite interesting.
321-403-8757. We'll
That
talk
is a
about the pain.
low
If
iliac
you've
crest.
had this,
If
you're
I
going to
had
want to
do
get rid of it.
L5S1, she would be the perfect
What a great
candidate.
place right
Because
here
the iliac
in
crest
Rockledge.
normally goes through the L4-5
Vieira,
disc space, much
where
higher.
we can
So
get
it's
rid of
really
it
hard to get
right
down
there.
to the L5S1
I
disc
wish
space.
I had
But
known
because the
this
iliac crest is low,
years
it
ago.
runs through the bottom half of the
But
L5
I did
body.
laser,
That
Duke
means
laser
getting into the
disc
L5S1
repair.
will
It
be
was
pretty
great.
easy for
My
her.
name's Randy
But
Quick.
we're not treating
and
L5S1,
If I have
we're only
anything
treating
else,
L4-5.
I know where I'm going. I'm going to Duke
Now,
Spine
we're
Institute.
about to enter the disc herniation. You feel anything?
For that too.
All right, she's still comfortable. So the
because you're seeing too much of this down here. It should all be green screen.
Alright, I'll lift it up then.
We don't want sloppy